I just wanted to start by asking you what do the latest predictions reveal at this moment? What can Quebecers expect right now?
Okay. Well, what I can tell you is that, well, you've probably seen that the cases in Quebec have been dropping pretty steadily since the beginning of January or mid-January. And it has started in the greater Montreal. It has started to increase end of March. What our model predicts is that this increase will accelerate in April and in May. And the more the population respects the measures put in place, the slower will be that increase. But if the population lowers its guards and does not respect fully the recommendations and the measures put in place, we see that the curve is very steep, that it will, increase pretty quickly. As you can see, I'm talking about the greater Montreal because our projections are not available for the rest of Quebec because of the complexity of the situation and the variability of the situation in all these other regions. So that's why for today, our projections are mainly focused on the greater Montreal. This means Montreal, Laval, Laurentides, Lanaudière, Montérégie. So it's really a very wide area, but it doesn't concern Quebec or Bas-Saint-Laurent. Or so if you have questions about these regions, I can answer some of those questions, but not on the basis of the projections.
Okay. And in terms of the caseload, so as you said, we've seen an increase since March. What can be expected in the next month, in the next coming weeks?
Okay. Well, what we can see, what the model predicts, is that anywhere between mid of April and mid of May, we could be, as far as cases are concerned, as high as in the peak of the second waves. So we talk about 2,000 cases in the greater Montreal. That's not just the cases put on our site, because in the cases that we can we can pick up, there's some cases we catch and some cases are just going around and we don't catch them. So when we say 2,000 cases at the peak of the second waves, it's the total cases that were going around and not the one necessarily on our website. So there's always a little difference between, the real cases and those we can catch. But if I resume, if things keep going on the way the model projects, we could be as high as at the peak of the second waves, anywhere between mid-April to mid-May, depending on how strict the population, how strictly the population follows the guides and the measures.
And of course, right now, we've been told many times that the variants are what are mostly worrisome for Quebecers right now. So, I'm going to ask you, are the variants really the dominant strain right now? And what does that mean for the population?
Well, in the rest of Quebec, the variants are really largely dominant, up to 95% in some regions. In the greater Montreal regions, we're seeing, we're anywhere between 45 to 55% of the new cases that are the variants. The problem with the variants is that they are more transmissible and they are more lethal. They produce more severe infections, and more people are going to be hospitalized, and there might be some deaths also. So that's a problem with the variants. And it is, since it's more transmissible, it's really going up quicker than the old strain of the coronavirus. So that's what we're facing now.
And the vaccination is going well. We're seeing an increase in people, the number of people vaccinated. Just yesterday, we opened up walk-in clinics, which is great. So how are vaccinations helping at the moment with either the variants or also the number of cases, the rising number of cases How is that all affecting the the situation right now?
Yeah. Well, what we see is that the vaccination is helping a lot on the hospitalizations. If the situation with, as for now in Quebec as a whole, today we're announcing 1,700 people being infected. If it was the same situation as before older people were vaccinated, we would have a lot more people in the hospitals. So that's what's going on with the vaccination. We started vaccinating the people who are more readily to be hospitalized if they catch the disease. So the older people and the people in the CHSLD are being protected by the vaccination. And now we're trying to vaccinate the whole population because there are some vulnerable people who live at home who are not healthcare workers. And the more the virus circulates in the population, the more chances there are that some vulnerable people will be infected and then they will be hospitalized because they are very sick and some might die. So we see the effect of the vaccination on the fact that even if there are many cases going up, the hospitalization tend to be pretty much under control because the older population, the more vulnerable population, has been vaccinated. So we're really hoping that the cases will not explode in the general population, going up to 3,000-4,000 cases. It's always a possibility. If this happens, more and more people who live at home and who are vulnerable might be infected, and we might have a rush in the hospitals. But as for now, it's pretty much under control. But our model predicts that if the population does not respect the rules, there will be an increase in hospitalization in the following month and mainly in May. And we could be, I don't know in English, we could be facing the same touchy situation as we faced in the peak of the second waves by the end of May if the population is not adherent to the measures. If the population is very strict and adheres to the measures, it will lower the impact on the hospitalization. There will be more hospitalization, but the system would probably be able to deal with it. So that's the touchy point.
And you mentioned earlier that the projections that you were talking to me about were concerning Greater Montreal. And if we look a little bit at the other regions, can you tell me what the next steps are for the other regions? The ones that we've been seeing that are increasing in cases, and what's going on there, and what's going to happen next?
Well, what we see, and that's not in the projections, but what we see in the numbers we're crunching every day, and all the numbers on the epidemiological situation and on the hospitalization, and what we see is that really because of the variant and the situation has deteriorate quite quickly and heavily in many regions. And we see an upward trend in the hospitalization. So it's still under control because there's capacity in other region, but we do see the upward curves increasing day after day in those regions where the variant has really taken over the whole situation. So while the next step has been put forward by the government, they've put those regions under high surveillance. They've put more restrictive measures, and they're asking the population to respect those measures because this is the only way we're going to lower the number of cases. And all the public health measures are being really, enhanced. Can you say that? So that the public health measures are being enhanced, and so everybody is trying to really control the situation. So population-wide measures, public health measures, population asked to be more compliant to the measures.